Today's Silicon Slopes Town Hall. My name is Clint Betts, and I'm the Executive Director of Silicon Slopes. As a reminder, we'll be hosting these town halls every Monday, Wednesday, and Friday at 4 p.m. For updates, to join our Slack channel, and to receive our COVID-19 newsletter, visit slopesserves.com so you can stay in the loop. I want to give a quick update on the progress we've made on slopesserves.com. Earlier today, we announced Ryan and Ashley Smith will be donating $1 million in conjunction with our efforts at SlopeServes to combat the effects of COVID-19. I also want to acknowledge Ancestry.com, who has donated $100,000 to SlopeServes, and Mark Newman from Romney Health, who has also donated $100,000 to SlopeServes. I also want to thank the many contributors who have donated whatever they can by going to slopesserves.com. The advantage Silicon Slopes has here is our ability to be nimble, act fast, and make an immediate impact. All of SlopeServes is being run through our 501c3 nonprofit, which makes donations tax deductible, and all funds will go directly to helping those affected by COVID-19 on both the health and economic impact of this pandemic. SlopeServes is working on three critical fronts right now. One, on the health front, we're doing what we can to get more tests in Utah and working with private sector partners and governments to get them here as quickly as possible. Mark Newman will have an update on that here in a moment on this town hall. We're also beginning to pivot into caring for the mental health of the Silicon Slopes and broader Utah community during these worrying times. We'll have more updates there in the coming days. Two, we're working on the supply front. Our hospitals and medical workers need supplies. Because Silicon Slopes doesn't have the bureaucracy of government or some larger NGOs, we're able to move swiftly to get them the supplies they need. Again, Mark Newman will be providing some updates on what we're doing there in this town hall. And finally, three, we're working on the economic impact of COVID-19. In the long term, I believe this is where Silicon Slopes will be most effective. On one of our recent town halls, we had Salt Lake City Mayor Aaron Mendenhall and actor Ty Burrell on to talk about getting a fund started to help displaced food and beverage workers. Today, Mayor Mendenhall and Ty announced a Tip Your Server fundraising campaign, which is being run through the Salt Lake City Downtown Alliance. Details on that fund can be found at downtownslc.org. Ty has put $100,000 into that fund himself, and I couldn't be more thankful for his leadership on this issue. We'll be providing more updates on our areas of focus and our total number of donations up to this point in the coming days, but I want to once again thank Ryan and Ashley Smith for their generous donation, as well as Ancestry.com and Mark Newman and Romney Health, and everyone who has gone to SlopeServes.com to donate and contribute to this important cause during this important time. To get involved, visit SlopeServes.com. That's SlopeServes.com to donate, volunteer, provide medical supplies, and keep informed on everything happening. We're going to get through this thing. And we're going to get through it like we always do in Utah together. In fact, I feel more hopeful and positive today than any time since this pandemic started. We've got this, thanks to the tireless efforts of all of you on this town hall and so many others throughout our state and country. And with that, I would like to bring on Senator Mike Lee to talk about what's happening on the federal level. Senator?
Thanks so much, Clint. Thanks for all of you for joining us for this. And I want to commend Silicon Slopes and all those who were involved in it and who helped make it a success for their involvement, their participation. This is a great example of businesses and individuals and families coming together in a way that no government ever could. You can operate far more efficiently than we do. There's a place for government, and sometimes it's necessary for us to step in. We don't ever do anything as well as you all do, so I appreciate that. I want to give you just a brief update on where we're focusing our efforts. We've, of course, had these 3 phases of coronavirus legislation. Phase 1 was dedicated to building up $8.5 billion of funds to be made available for local governments and for healthcare infrastructure to get ready for the virus. Phase 2 dealt with paid sick leave. It created a big, huge problem because there was a drafting error in it. People recognized that we need to help people who might get furloughed as a result of the virus. They didn't realize until after it had been passed that it's going to result in this perverse incentive to fire workers. I drafted an amendment working through the night with a number of my colleagues. We voted on that amendment. We got a majority of the US Senate to vote for that amendment, but unfortunately through a quirk of the Senate's own procedures, that amendment wasn't in the final version of phase 2, forcing me to vote against it. Our job is to first do no harm. We can't pass a law with my vote that's going to harm the very people who are supposed to be helped by that law. I'm trying to get that fixed in phase 3. Phase 3 has as its focus encouraging and promoting liquidity within the marketplace and getting money out to those who need it most. It's still under negotiation. And so we don't know what's in it because I don't know what's in it yet. I can't tell you what its likelihood of passage is or the likelihood of my supporting it. I'm working with my staff right now to improve it, to make it better, and to fix the errors, the harms that were done through phase 2.
Senator, I have a follow-up question just real quick on the relief bill that you voted against. And I heard your explanation there. We know that Senator Mitt Romney voted for it. Can you go a little bit deeper on that?
Yeah.
On why you voted against that and kind of what the process is like out there?
Yeah, I'd be happy to. So phase 2 passed the House of Representatives last Friday night in the middle of the night. Members had the opportunity to see it for exactly 15 minutes between midnight Friday night and 12:15 when the House voted on it. It was a 110-page bill. Over the weekend, they found 90 pages of technical corrections they needed to make. Ordinarily, that's not considered a technical correction. Usually, a technical correction is when you've got to add a comma that you left out, or you forgot to insert the word not or something. This one replaced 90 of the 110 pages on Monday. Between when we received the bill on Tuesday and when we had to vote on it on Wednesday, I identified this error, which we all acknowledge. The most important people for us to protect in this legislation are those who are workers likely to be displaced as a result of the virus, likely to be furloughed or otherwise out of work for a period of time, either because they get sick or someone in their family or their office does. For those people, we all agree that we've got to help them. The way that the House passed bill, quote unquote, helps them is to put a new mandate on employers to pay into a system to expend significant costs, creating a new paid sick leave program for them. As we all know, you get what you incentivize, and what you incentivize here is shrinking your workforce, firing existing workers so that you don't have to incur the additional expense associated with it. I found another way of doing it. It would cost the government more money, but it was an expense worth incurring here by saying, rather than put that expense on the employer, which is going to result in people getting fired, put the expense on the unemployment insurance program, which the federal government would then backfill. This would solve the problem. A majority of senators agreed, but through a procedural quirk, it didn't get in there. So the bill we passed will actually harm people. It's going to result in massive layoffs if we don't fix it. That's why I voted against the bill as a whole after the amendment wasn't included in the final vote. I can't speak for Mitt Romney or any of the people who voted for it, but I will say this. Those who were critical of those of us who voted against it hadn't read the bill. They did not understand the quirk they were talking about. I'm not going to speak for any particular colleague, but on the whole, those who were criticizing it didn't grasp what we were trying to do.
So when can Americans and Utahns expect to get relief from the federal government here, do you think, Senator?
Phase 3 is going to be the bill that most likely affects the most people directly, including through a series of direct payments that are currently under the current Republican proposal were supposed to be set at about $1,200 per adult and $500 per child, phasing out at $150,000 in family income for a married couple filing jointly, $75,000 for an individual filer. Those checks, assuming this legislation is passed, it's likely to be passed in the Senate by Monday or Tuesday, passed in the House within 24 hours after that, signed into law by the president immediately. The assumption is that within a week or two, people will start receiving their first direct payment checks.
How is Utah doing in comparison to other states in the country? I mean, you're tracking this, as representing Utah in the United States Senate, but you're also, in there, DC, and you've been in meetings with, I'm sure, the president and others on this issue. How are we doing in comparison to other states? I mean, you're seeing California say, basically mandating everybody stay home. I believe Illinois or Ohio, one of those states, just barely did that before we came on this call. How are we doing? How are the local elected officials doing here? And just on a whole, how is Utah comparing?
From my perspective and the perspective of my colleagues and people in the executive branch of government, Utah's doing phenomenally well. Look, we're all in this together and we're all struggling. But Utah is ahead of the curve, in part because of organizations like Silicon Slopes, and in part because we've got a state government that works better than most state governments. I was very skeptical of Governor Gavin Newsom's order last night. I thought it was draconian. I thought it was chilling. The way he set up that order, I think it sends a lot of the wrong messages. Utah, on the other hand, is encouraging people to do the right thing rather than acting with overly heavy hand.
Senator, you're breaking up just a little bit. Can you hear me?
Yes, I can hear you.
Yeah, you're back here. How are you and your family dealing with this personally?
Well, it's hard. My family is all in Utah, and I'm here. We talk on the phone every day, multiple times a day, over the phone and by text. They are all sheltering in place and using social isolation as a tool. My son James is a second-year law student at BYU, and they've canceled class there. Yesterday, his wife sent a text to our family group text, a short video clip of James in their apartment going to the window and saying, "Help, I'm an extrovert and I'm succumbing to the dangers of social isolation. I need attention." So we gave him attention through the family text chain. But it's one of the things that somebody has to do to stay sane. In the meantime, I miss my family. I can't go back until this is done, but I hope they're doing well. From what they tell me, they are.
On this town hall, you have business leaders, CEOs, executives, employees. I mean, this is being streamed on all of Silicon Slopes' social media channels as well. How can Silicon Slopes help? How can business help? How can community leaders and community organizations who aren't elected officials or in government help?
Well, first of all, just keep doing what you all are doing. Every one of my colleagues is envious of the institutions of civil society that we have within our state. People like you and like Ryan Smith and like Mark Newman, with whom I've been in contact over the last couple of days, talking about what you're doing. I'm very grateful for everything you're doing to prepare for this illness, to prepare to help people to cope with it. So I would encourage people to just continue to find ways where you can make an individual difference. In a conversation I had with Mark Newman last night, he was pointing out to me that incremental steps, when he can find donations to be made, even, I think he used the word micro donation or micro quantity, he can add to the overall extent to which we're alleviating human suffering. And it's not just the suffering that we're going to encounter as we enter this next 2 to 3 week period, where I had a good meeting at the White House the other day, and I was given the explanation by some of our top security experts. Then the most difficult initial wave of this, we don't know how long it'll last, but it'll be within the next 2 to 3 weeks when this wave hits us really hard. So it's not only the experience of that wave itself and what comes after it, but it's also the imminent apprehension of that wave hitting can be devastating. And so for that reason, what you're preparing to do not only calms people as they go through the experience, but also as they approach it.
Senator, if you can stay on for a minute, we have a Q&A thing for those inside of this town hall on Zoom. If you have questions for Senator Lee, please put them in there, and I'll come back to you here in just a second, Senator. We have Lieutenant Governor Cox, who's just joined us. Lieutenant Governor, are you on?
I am on, Clint. Yeah.
It's great to see you, sir. You've had some big personal news on the campaign front, announcing a running mate. I'm sure that's odd to do at a time like this, but congratulations on that front. Can you give us an update from the state?
Sure. Thank you. So today has been a really important day working on testing, always testing. It seems like that's the update we're always trying to give. The good news is you'll see we have ramped up testing a little bit today if you look at the latest numbers. And by Monday, we're hopeful that we'll be testing around 1,000 a day, hoping to double that by the next week, maybe even more as these additional supplies start coming in and we're able to ramp up capacity. That's a big deal. I will tell you right now, one of the biggest limiting factors that we have in the state and across the country is the PPE, the personal protective equipment that is needed to keep our frontline workers safe. We've heard a lot about the N95 masks. We're actually working on getting more of those, and that's going okay. But there are several other pieces of that equipment, the gowns that they wear, that's actually the thing we're struggling with the most right now. And of course, gloves and the face shields. Those are the types of things that we're working on to get. So I'm grateful for everybody that has stepped up to help us with that. We've had people from the private sector who have come to help us, especially with the masks. And we're working on the other stuff as well. One of the big changes right now is really limiting elective surgeries. That's so important because elective surgeries take a lot of that PPE and of course the bed space. And so fortunately, IHC and the University of Utah early this week stopped doing elective surgeries. We've been working with the Hospital Association and others who are making that decision as well. And we think we've got most of them on board right now. That's also the recommendation coming out of CMS, out of the federal government, that we stop those elective surgeries. We're working with the Dental Association, as well as the Veterinary Association. They also have the PPE, and we're working with them to donate as they have extra. So it's just all hands on deck, and we're moving forward. I'm happy to answer any questions you have.
Spencer, is it okay if I call you Spencer instead of Lieutenant Governor?
Always do.
Okay, good. I have a question for you. Contact info for where these supplies that you just mentioned should be sent and delivered.
We have contact info. I'll send it to you, Clint.
Send it and we'll shoot it out to everybody on this call. That's perfect. Yep. There's another one here. Is there any discussion about suspending work requirements on Medicaid right now?
Suspending work requirements on Medicaid. We have a Medicaid group that is meeting and discussing. In fact, we have a group that's talking about all potential changes that we can do here at the state level to help people out. And I believe that's one of the items on their list that they're meeting about. Legislative leadership is going to be looking. Of course, we know what's happening at the federal level. I know. I think there's Senator Lee and others of our congressional delegation talking about that. We've got a group here, legislative leadership, is going to be talking about everything that can be done at the state level to help people out. And so they met yesterday, and they're going to have more meetings going on over the coming days.
Spencer, I have a question too about a company called MedCentral. This is another one, kind of like Co-Diagnostics, over the past like 72 hours or however long we've been doing this, kind of circulating within the Silicon Slopes community. They say they have home test kits that just need to get to labs to be validated. Have you been in contact with MedCentral at all? Could we help you get in contact with them?
Yeah, so I personally not been, but we have an innovation team that's working with all of these companies in Utah and elsewhere that are coming in. I think they have been. I will follow up and make sure. Send me the contact information directly. But I know we had a conversation about home testing kits, and so unless there's two companies in Utah, I'm assuming that's the one.
I bet that's the one. I'll send you the direct contact info after this as well. Real quick,
And let me just
yeah,
say
yeah.
the reason testing so oh, good. I was just going to say the reason testing is so important is we can make better decisions with testing, and the more testing we have, and that's going to help us not only figure out where the disease is and how it's spreading, but that's going to help us get out of this a lot quicker. And so any innovation in testing, especially one that involves speed and then the total number of tests is going to be huge. That's really what's going to move us through this quicker.
And for those donations of supplies, like if you want to tell your staff and like on slopeserves.com, we have a volunteer kind of army set up, ready to make these donations. So anything you need there, feel free to work with SlopeServes and have them go to slopeserves.com. There's still a little bit of confusion around co-diagnostics. I was talking to their CEO last night, and Mark Newman's going to have an update here on this town hall a little bit later on that. Has there been any updates on that? Since I know we had you on Wednesday night to talk about co-diagnostics and where that's at. Could you give us an update now, 48 hours later, on where that's at?
Yeah, well, they may have the latest, and again, my vernacular, I'm not the expert. So basically, obviously, they have the test kit and the full test kit, and those test kits are critical, and they're making thousands of them, and that's a really big deal. They did get FDA approval, and I know again our congressional delegation was helpful with that. What we lack right now, and what many states lack, are what are called extraction kits. Those extraction kits are made by another company, and the testing equipment that we have, you have to extract the RNA of the virus before you can test it with their testing kits. And so that's the piece that has been missing. We fortunately, again, Silicon Slope helped us out. There was a person here in the state of Utah who had 700 of those, which was awesome. They working with Co-Diagnostics, they'd ordered 10,000 of those kits from the company is called Qiagen. Sorry, I get that wrong every time. Spelled with Q. Qiagen is the company that makes those kits that we use on the machines here. We also have a lead on other extraction kits that will need to be validated with the Co-Diagnostics test, and we're getting those in and making that run. So this is really going to help us next week with that significant ramp up. And by the way, Co-Diagnostics has been amazing. Those guys are incredible, and I just wish we had somebody here who made those very specific extraction kits.
Real quick on the small business front and helping on the economic front, I know that there was an economic task force announced over the past, again, I don't know, but there's so many task force and press conferences, Spencer. It's hard to keep track, but can you talk about like the task force that was done like through you and the governor? I think Derek Miller from the Salt Lake Chamber is leading that up, and what's being done just even generally around small businesses? Because you have a lot of top CEOs here, top leaders within the Utah tech and business community here, and how can the tech community help small businesses, and what is this task force doing on that front as well?
Yeah, so they're going to be releasing their plan, I think on Monday, Tuesday at the latest. But basically, it's a 3-phase plan as they're working through kind of this first just the first 2 weeks of this and what we can do immediately. Compiling all the resources again from the federal level, the state level, the local level, and then they've got a medium term and then the turnaround, the long term phase, and all of those things will be announced next week. But there are great things happening with our local leaders in that announcement today. We had leadership from all across the state, and it's incredible. Zions Bank was on there talking about what they're doing with foreclosures and limiting the foreclosures, giving people loan extensions to help people out. That was huge. We talked to some of our utilities. Talking to Rocky Mountain Power, they're not going to be disconnecting anybody right now. So those are really important things that are happening. AT&T was there, Smith Foods, the Restaurant Association, all talking about things that they can do. And what's incredible is to see the private sector come around. I know that Mayor Mendenhall, working with the chamber, and announced today this idea of takeout, that everybody should be doing more takeout from our local restaurants. And those are the types of initiatives that are moving forward. And we'll send you out a list of those as well that we can share with the entire group.
Senator Lee, I have a question for you.
Can
Kind
I
of,
add one more thing
yeah,
before I
please.
jump off?
Please.
Governor Herbert has declared this weekend a weekend of prayer and service. Both. If you believe in a higher power, if you don't, if you believe that the universe is conspiring to do good, we need those positive vibes and those positive messages. But just as important is a weekend of service, that every one of us needs to find at least one and hopefully multiple ways to serve people that are close to us. This is going to be incredible for the state, good for our psyche, good for our friends and neighbors, good for those who are the most vulnerable. You guys are doing this every day, but let's make sure that we get the word out on that, and let's get all of Utah together.
Thank you, Spencer. Really appreciate it. Thanks for taking the time.
Thanks, guys.
Good seeing you. Senator Lee, I have a similar question on the small business front. On a previous call, we talked to Senator Romney about this issue. And, he was thinking about maybe doing 100% guaranteed SBA loans. What are they thinking on the federal side of this to help small businesses? And what are you supporting on that front?
Yeah, Senator Romney is right. And it looks like we're moving in that direction. In the proposal that was published yesterday by Senator McConnell, and it's being negotiated right now with Senator Schumer, we would have SBA loans covering up to 100%. And we'd also see one thing that might ease some of the burden, even if we can't get the fix for phase 2 in there. One of the things that might ease some of the burden associated with phase 2 that I described a minute ago is that they would not require any payments back from small business during the affected period. If during that affected period, the companies in question continued to pay their payroll, continued to pay their employees, rather than furloughing them or letting them go. So there is going to be substantial relief for small business in this bill. We're not exactly what it's going to look like, but it's going to be substantial. We're talking about $150 billion or so that will be available for small business specifically, with 100% attached to it.
We're getting so many questions as we're streaming here, Senator Lee, about just how to keep small businesses from going bankrupt.
Yeah, well, we've been focusing a lot on that, and I've had a lot of conversations with business and government leaders across Utah over the last week, many of which have had a significant impact on what we've discussed here in the Senate. The other day, for example, Tuesday night, as I was working on this amendment with a few of my colleagues, I got a call from Speaker Brad Wilson. Brad told me what he was thinking as far as what banks would like to be able to do. Banks and credit unions, lenders generally, when approaching small businesses, would love to make clear to them that for at least the next couple of months, at least for April and for May, they're going to be willing to look at payments coming in and to suspend them without taking any adverse action against the borrower. What that's going to do is allow them to maintain their other fixed costs without risk of going bankrupt or having their assets seized or their loans foreclosed upon. And then they'll be able to move forward and hopefully be able to keep their business intact and their workers working. One of the key impediments to this could be with the banks and the credit unions themselves. I made a bunch of phone calls on that, talked to my friends on the banking committee and in the Senate, the chairman of the banking committee included. And what I've concluded is that most of the lenders in our state and nationally would prefer not to have to take any adverse action. So it's a regulatory question. So I looked into the regulators. I had a good conversation yesterday with Mary Daly, who's the president and CEO of the Federal Reserve Bank of San Francisco, which of course takes in many Western states, including our own. She confirmed what I had heard from my colleagues after discussing this with them. This has now become a common conversation in the Senate. In addition to legislation that we're going to enact to provide relief, we're also seeing that we're going to have regulatory relief provided by the banking and credit union regulators and make clear that there won't be any adverse regulatory consequence to the lender by choosing to forego any options they may have for payments missed in April and in May. I think this will go a long way toward maintaining liquidity in the marketplace and keeping businesses intact so that they don't have to fire employees. so that they don't have to go bankrupt, so that they can stay in business. Is look, this wave is coming, but it's going to pass. It's not going to be easy, but the first wave of it, once it passes, I think is going to allow us to exhale and get back to work. But it's that critical first 2 months that it's going to be most important. Fortunately, the entire country, and I can say virtually every member of the United States Senate, is focused first and foremost on small business.
Senator, thanks so much for coming on. As mentioned, we do these every Monday, Wednesday, Friday. I'm sure we'll have you back on again, and we'll be in touch with your office in the meantime. Thank you so much for taking the time. I want to move now to, we had Senator Romney ready to go here. He got pulled into an emergency meeting, but we still wanted to hear from his office. So we brought on someone just as good as Mitt Romney, if you ask me, his Chief of Staff, Matt Waldrop. Matt, can you give us an update on Senator Romney's side?
I want to make sure you can hear me. Can you hear me okay?
We can hear you.
Okay, and you really don't want to hear from me, so I'll be very brief. Even with that glowing introduction, Clint, it was great to hear from Senator Lee. I will just say, from a perspective of somebody who's not one of the elected lawmakers, of course, back here in Washington, seeing the way that these lawmakers are working right now is actually quite inspiring. It's a body that gets made fun of a lot, but they are all really burning at both ends. Working very hard to come up with solutions to help everybody. I did talk to Senator Romney not too long ago, and I know exactly what he was going to cover. I'll do it in much shorter fashion. The first thing he wanted to do was just to remind everybody, and we've tried to put this message out as well, to continue to buy and spend and support and encourage people to buy and spend and support to the extent you can within means local businesses to the extent that is at all possible. It's very important at this time, and a message that we are trying to continue to get out there as well. I'll also give next bit of update. One is on what is happening with Utahns who are stuck around the world, are stuck in other countries. Everyone saw the State Department update discouraging phone travel from anywhere and going anywhere, and that means that there are Americans stuck all around the world, or at least nervous that they're going to be stuck. And so there is a unique setup between Senator Lee's office and Senator Romney's office, something that, to our knowledge, has never been done in a United States Senate office, where this kind of work, which they call casework, which is just constituent services, is done jointly, that the people on the team that do it are employees of both Senator Lee and Senator Romney's offices. And we have Utahns all over the world. Think of the missionaries that are all over the world. Think of the travelers as well. But we've been in close touch with, among other entities, the LDS Church and their missionary program. Those calls have been happening sometimes in the middle of the night, getting 180 missionaries out of the Philippines, because the Philippines closed their borders, and needing to open up hotels and get Delta charter flights to happen. And so the reason Senator Romney wanted to bring that up is because of the Mr. Rogers quote that I think we're all familiar with, to pause during times like this and pause during scary times and notice all the good that's happening. And this group that's on the phone right now and on the video exemplifies that. You heard a lot about what's happening from Senator Lee. You know, the Senate has set up these task forces that are dealing with various issues related to the economic recovery and the health recovery. Senator Romney is on one of those, and they called the task force meeting tonight. The one that he is on is assistance for individuals, families, and unemployment. So again, a lot of the issues that Senator Lee touched on. And so they're meeting tonight. You know, it's a Friday night. They're going to meet again tomorrow morning. They're going to be drafting bills that hopefully reflect the best of what our country has to offer. And they're going to work through the weekend, as you heard Senator Lee reference, with the hopes that a vote can be held early next week to get this thing moving. You've heard Senator Romney say multiple times, we got to get money out to the people. He is certainly one who is in that boat. You've heard, you know, he proposed $1,000 to American taxpayers. There's disagreement on exactly who should get it, and there's criticisms on who should get it, who shouldn't get it. His point is that what we ought to make sure we don't do is see the building on fire be the fire department that sees the building on fire down the street, and you have the fire department standing around arguing over which fire truck you send in to stop the flames. It's like, in some instances, we just need to get a fire truck there as quickly as possible. So some say, we need to continue to address unemployment insurance and all these other issues. And it's like, yeah, we need to do that as well. But let's get money out to the American people, because it will give help to our psyche. It'll also give help to people who are in hardship because they need to buy things. And additionally, it will help stimulate things a little bit. So you've heard from them. I've heard from, and our office has heard from dozens of you. We're happy to provide updates as it comes, but know that the Senate and the Congress, they met today, and they'll be working through the weekend. And the next step of this will be explaining to all of you what the heck this bill that is going to be voted on and get passed before too long, what the heck it means. And so there are going to be so many questions as to, okay, how does this affect me? How does this not affect me? We held a 2-hour meeting with almost our full team today. We were building a website specifically to help break that down. Now the federal government, they're going to put something up, and there's going to be all sorts of help sites. We have learned not to necessarily trust any other source. So we're going to independently do our best to create a source specific to Utah and what it means to Utahns. And then we'll have a staff person dedicated. If you're a restaurant owner, who you can call. If you're a large employer, who you can call. If you're someone who is laid off or furloughed, who you can call. And so we'll be ready for that, because that's going to be the big part. Right now, as we've been talking to you all, we've had to guess what is going to happen and then how it will affect you. Soon, before too long, there will actually be something in place, and we'll just have to explain it. So that's our next step. And I'll shut up now, Clint.
No, that was amazing. Thanks so much, Matt. We'll have Mitt on again, I'm sure. Our next one's on Monday. We're planning on having
sorry about
back.
that.
No worries. Thanks so much, Matt. Now I want to go to Qualtrics CEO Ryan Smith. I want to, Ryan, just acknowledge you in front of everyone for the donation that you announced earlier today, and also just to get a sense for how this is impacting. I mean, Qualtrics is one of our, if not the biggest tech company. Well, it certainly is the biggest tech company in Utah at this point, with coming together of SAP. How you're responding to this, the data you're hearing on the work from home front, and also just the human side with your employees.
Yeah. So first of all, Clint, this is freaking amazing. Like, I'll be honest, having Senator Lee, having Lieutenant Governor, and hearing from Romney's camp, I don't think there's another place in the world where this is happening. So keep it up. I think we're seeing a theme not only on the private side, but also as a community, that communication is helping relieve stress. I'll be honest, everyone is working from home. There's not one CEO I've talked to who's prepared for it. So here we are, all in the new world, the new. And to compound that, we're seeing a lot of data coming back that is showing that the work environment at home is just fundamentally different. It's challenging. It's incredibly stressful. We weren't prepared for it. So we created an instrument internally that we call our Remote Office Employee Pulse. And it has been game changing for us. We created, first question was basically, is everyone okay? And that is something that we are continually asking people. And then the second is, what can we do and what do we need? And what can we help people with? And we found that people didn't have workstations. They didn't have cable cords. They didn't have computers and monitors. And we basically said, take whatever you want out of the office, And then lastly, it's like, how can we help people feel productive? We all need to be spending, but we also all need to be feeling productive, or we're going to go nuts, especially if we're all quarantined for 30 days or however long it's going to be, because as a community, we are the people who also work in a broader organization. So this has been game changing for us. We rolled it out and basically gave this instrument away for free. We have 3,500 organizations on it already. And the data is coming back pretty similar, that people are feeling incredibly stressed. We talked earlier, Clint, about, people can handle change, but when they don't anticipate what's going to happen, it's tough for people to handle. And if someone hasn't worked from home before, the data is showing clearly that they are 2x more likely to deal with massive stress without directive. So as employers, as people managers, if we can help people understand the expectations of your people and your teams of what it means to be in this new, it can reduce stress for a lot of our workers in Utah, on the tech side at least, that are in their first rodeo, by up to 2x. The other thing is people are definitely feeling separation anxiety from teams. So anything we can do to collaborate from that standpoint is extremely helpful. I think that town halls like this or anything on that front. And then I think the lastly is just how to help people be productive and creating a work environment. Find a spot, find a space, get dressed in the morning like you would go. I was just talking to a friend in LA who actually takes his lunch into this work environment. So it feels like they're actually going to work. Get dressed in the morning, have a to-do list. As great as it is to be in loungewear all the time, and I'm probably not the best example, but this is how I dress. But that's what we're seeing. And we're, if you go to Qualtrics, here to help. Anyone can grab these solutions. They're free to the world. We've got one for educators. We've got one that we're running COVID-19 assessment for 15 countries right now, where they can look and assess and use this as an assessment to understand how big the problem is. But we're going to get through it. This is challenging. It's probably never going to be the same for any of us after this, and the way we work and the way we use technology as we know it is changed. I don't think that's necessarily a bad thing, but it's going to be a little rocky.
And so people can go to Qualtrics.com and it's here to help, right? Like Qualtrics.com/here-to-help.
Go here to help, HERE to help, and you can get started. It's free. There's no strings attached. I've talked to 5 CEOs today from all over the world saying, oh my gosh, like my ability to check in at scale with our employee base has taught me where to hit and where to go. Everyone's trying to take action, and we can't look at the government, as Senator Lee said so eloquently. It's like, you guys are able to do things that we can't do. It's unrealistic that the government's going to solve our healthcare stuff, our economic stuff, as well as our food. And as employers, as people part of organizations, as Lieutenant Governor just said, like, we can help serve. And if we know where the buttons are and what we need to do, we don't waste time. We're right. And we all have limited resources right now. So being right is definitely a premium. And I think everyone's got a willingness. And community is something that's very theoretical until we need it. And I couldn't be more proud of the Silicon Slopes community, and everyone's a part of it. Doesn't matter whether you're in tech or not. Like, I think we're going to rally here in Utah as much as we possibly can.
And finally, Ryan, just real quick on the Silicon Slopes front, and again, like an incredible with you and your wife Ashley putting $1 million to combat COVID, kind of in conjunction with the Slope Serves efforts. What is your message? Just as one of the Silicon Slopes founders of this thing, and you and I have worked closely over the years. What is your message to all the Silicon Slopes employees and CEOs and folks listening to this right now on how we can serve and how we can give back and how we can get through this thing?
Well, I think, look, a lot is yet to hit, as we've seen. I think the Silicon Slopes Serves Fund's an opportunity for us to reach out locally. Our hope is that we can, give back a little bit and then say, hey, how can we put this together in conjunction with Silicon Slopes Serves? And then I've been talking a lot with Mark Newman. We're also waiting on the government to where they're going to help, and then we can augment around. But I think first and foremost, as many jobs as we can maintain right now in Utah, I just from the bottom of my heart, there's no competition right now. Like, let's just pace ourselves, pump the brakes. It doesn't matter if you're not hiring. It's responsible. if you're in a decent financial spot, stay there, and urge your companies to stay there. I think everyone needs to be in a spot where we can weather this out and be in the strong financial position that we have been. We've been leading the country and places to work and everything. And we just need to maintain that and be smart. We don't know how long this is going to go. And we don't want to come out the gates too fast. We want to be wise and be able to endure. And I think that's what we do in Utah. And I think there's a lot of people watching us. And that's my recommendation, is just as employers, as employees, as people, as family, let's just be patient, and we will get through this. It seems like every day feels like a new week where we're turning over more cards and we have a little bit more clarity of where we can help. Our donation, our contribution, what Qualtrics, I'm watching all the other companies jump in, and it's just inspiring. Get behind it and help where you can. You don't have to have a ton of resources to be able to do this. Everyone can help. I love the lieutenant governor talking about, service or prayer or however to have positive juju in the environment right now. We need it. And this is really cool, but it's also really challenging.
Thanks, brother. Seriously, can't thank you enough for everything. You're an amazing leader, my friend. Thanks so much.
We're all in on Utah. Let's go.
Thank you. So I'm going to move to Salt Lake County Mayor Jenny Wilson, who is on the line with us now to give us an update on, you've had quite the week, Mayor Wilson, with the earthquake and everything going on with COVID-19. And then last night there was the Salt Lake County Health Department saying that there would be like a misdemeanor B around if there's gatherings of more than 10 people. Can you help clear some of that up and just tell us, what's going on in Salt Lake County?
Yeah, well, let me start with the last point that you made regarding the confusion around the health order, and then we'll get to some of the more general thoughts. So we declared some time ago, and I think the public's more than aware, a health order that limited how restaurants operate, closed the interiors and patios of restaurants, but allowed for the takeout and other measures, closed bars, unfortunately. And then additionally, we provided some general health guidance. The guidance we provided at that time limited social gatherings and kind of the more connected community gatherings to 50 people. And then we continue to follow CDC guidance and work with this, just generally reviewing what the CDC is up to as our best source of information on health directives. And we have a great partnership here. Myself, Salt Lake County Executive Director of our health department, working side by side with emergency management. And we move forward with that. The next day, the state followed. And when they issued their almost, I'd say, fairly close to complete compliant to ours guidance, they also issued a mass gathering limitation to 10. Lowering it from ours. So that was the one significant change. And we were a little bit surprised, but there was a directive or at least advice by the president that day. And so we sort of figured maybe that was what they were doing. And we talked amongst ourselves, our legal team, myself, and decided we were going to have to follow to modify ours. As a subset of the state, we need to be in compliance with the state order. So we discussed it and we said, we probably got till tomorrow morning. Let's read it a little more carefully. We left the office the night of the 16th, the night of the 17th. And of course, we know what happened the next day, the earthquake. So got back to business yesterday and went ahead to mirror the order of the state. We dropped ours to 10. And then by the end of the day, we were being accused at the county level of implementing a pretty strong directive for gatherings over 10 people. I was like, hey, what's up? We had been okay with the 50. Our health department director even today is okay with a larger gathering, provided people practice social distancing. We feel that people have been really great to conform. None of us are traveling, as was mentioned by many of the speakers, and we might be getting a little bored at home, but we're doing it for the right reasons. And I really appreciate the businesses accommodating the ask and working to let employees where possible work from home, and adjust operations for those who stay in to provide that social distancing. So with that, we were a little surprised, and we've now been trying to clarify with the state, and I appreciate the governor came out and said there had been a miscommunication, and these things happen. We're working well with the state, health department to health department, emergency management to emergency management. I'm getting answers when I need them, but when we're moving so quickly, these things happen.
So, Mayor, which policy do you think is right for Utahns? Taking aside like all the, just putting aside for a second all the procedural stuff, right, and the kind of back and forth internally between the county and the state. What policy do you think is best for all Utahns?
Well, what I think is best is each local health authority runs itself, right? We have a different need in Salt Lake County for certain infectious diseases. Forget COVID-19, which is unique to us all, but we operate with different resources, different size of health departments. And I'm the first to acknowledge that the social distancing issues in a very small county like Daggett County may be less of an issue than here in Salt Lake County. We've seen what's happened in very populated areas right now, and our health department is watching and working to monitor, as we all really, what's going on in New York. What about what happened in California yesterday? My needs here as a mayor, in cooperation with our health, and not in another county. So I think maintaining some flexibility is a good thing. But we can, if you're a small business in, say Daggett County or Garfield County, you should still social distance. That same spirit applies to a more populated area. So I think there's some things that would be uniform and some things that aren't. And we're right now comparing language with the state. We're doing it at this moment, the attorneys and the health officials with me and reading here and there. And I think
Mayor Wilson, you have cut out on us. I'm not sure what happened there, but we'll come back to you. We'll bring you back on Monday once we get a better internet connection. If we have anything,
probably have good enough guidance that could be applied throughout the store.
So thank you, Mayor Wilson, for coming on.
Guidance that could be applied throughout the state.
Now I want to go to the president of BYU Pathway Worldwide and a good friend of mine.
And that would be our.
Oh, sorry, Mayor Wilson. Do we have Mayor Wilson? Drew, could you figure that out? I'm going to go to Clark Gilbert now, who is the president of BYU Pathway Worldwide. Clark, how are you, my friend?
I'm doing great. Thanks for involving us.
Thanks for joining us. Tell us how this is affecting education. And you, a lot of people probably don't know, you run probably the largest online school in the world. Tell us how it's working out.
Well, it's been quite a week, and we serve 50,000 students worldwide, but we have 10,000 students right here in the state of Utah. And I'd like to emphasize something Ryan Smith said, that communication can relieve a lot of stress. We also feel like in a time of crisis with so much movement, maintaining some rhythm or continuity in individuals' regular life also provides a lot of emotional and spiritual stability when so much is moving around. And this week we run online, but we do gather people, Clint, in physical locations, usually in LDS church meeting houses all over the world once a week. All of that went to Zoom this week all over the world, and it's gone amazingly well. We had some hiccups in Africa, but here in the United States and throughout Utah, we converted all of those physical gatherings to virtual gatherings over Zoom. And it looks like we'll be able to run it full scale right through the crisis. One concern I have, and it's not the immediate concern, Senator Lee talked about this wave that may be passing over us and we've got to weather, but we are going to have to work to start rebuilding the economy. And we see a lot of people kind of in paralysis, whether they're young college students or adult learners. They're so nervous about what's going on that they really have stopped everything. And communication can help with that, but we need to find ways to have people doing normal things during the day. I think there's a tendency to only live in crisis mode. And it's really important people keep moving forward with some semblance of normalcy. And when this wave does pass and we start to move back to a more normal life, there's going to be a lot of rebuilding of the economy. BYU Pathway is really designed to serve the most vulnerable. Our students are almost all first-generation college students. They're almost all from the bottom quartile of income demographics. And having some education, even in professional certificates and degrees that lead to immediate work, is going to be really important for the workforce as we come out of this. And we're really hoping that we can keep students progressing and moving and not letting the crisis kind of paralyze their progress.
Clark, I'm just wondering, because BYU Pathways has been pioneering this model of, and like you said, I know you meet in person, but pioneering this model of online education for quite some time. This is a new thing for a lot of education institutions, a new thing for public education, it's a new thing for K through 12, it's a new thing for kind of all of our universities, both private and public. What advice do you have to educators and these institutions, and what example or what could they learn from BYU Pathways?
Yeah, Clint, there's really two things going on. Right now, there's a lot of institutions trying to bridge through the end of a semester. And we applaud those efforts. That's going on with my kids' school in K through 12. It's going on at universities. And a lot of that is really remote education. It's not really online learning. The courses weren't designed to be online. The interactions don't have an online design element. They're really using email and posting boards to kind of get information out. And that may have to happen over the next 3 to 6 weeks just to get schools and universities through the end of a semester. We've created some tools that we shared with other universities and other departments of the church, frankly, on how to bridge that gap in the short term. But that's very different than long-term designing remote experiences. I think I heard Ryan and some other people talk about remote work and how stressful that is. And, learning how to design it, not just to get through the next week, but from the ground up in a way that leads to great student outcomes. I think you're going to need educators to kind of have a short-term bridge, but then long-term, you're going to have to come back with more robust online course designs and learning strategies that really work.
Thanks, Clark. Appreciate you coming on. We'll be in touch, I'm sure, and bring you back to get a little bit more in depth on what you're working on. Now I want to go to the Executive Director of the American Red Cross here in the Utah and Nevada Division, Adam Whitaker. Adam, you and I talked on a live, and I would encourage people to go look at that. But just real briefly here in a minute or two, can you talk to our community about how we can help the Red Cross, the issues that you're facing, and the best way for the Silicon Slopes community to step in?
Thank you, Clint, and thank you everyone who's attending. We need the whole community to make this work, and this forum is a perfect example of how that can and is working. It's tremendous. It feels great to be a part of that community. The greatest need that I can illustrate from the perspective of the missions of the American Red Cross specifically right now is what we're seeing in impact at hospitals. We are a significant supplier of a majority of blood throughout Utah's hospitals. And because of the necessity with COVID-19 of social distancing, the blood supply has gone down. Blood I am also not a technical expert here, but I'm fairly well versed. You can't store it long term. You can't stockpile blood. It has a very short shelf life. And so from the arm of a giving donor to the testing facility in Salt Lake City, to the shelves of the hospital, back into a patient in need is a matter just of a few days. And so it's direly important that we keep that particular mission going. Lots of drives have canceled on the fears of being too close to people, and on appropriate orders to not gather in large groups. We've heard that mentioned several times. So we've taken significant measures to make sure that blood donation remains safe, that contingencies are in place to make sure that proper screening takes place at the point of entry at a fixed site donation center. We have those, by the way, in Layton, in Murray, in Orem, and in St. George, so across the state, up and down the Wasatch Front. But we're making sure that people that are presenting as potential donors are being screened, that they're not symptomatic, and that they're healthy, that workers, phlebotomists are healthy, that the environment is sanitary and healthy. Blood donation remains. The CDC confirms with a release today that blood donation is safe, and we need the community's help to make that happen.
Adam, thanks so much for coming on. And again, Adam and I went in depth for those watching this live right now, or recording of it. We went in depth earlier today. I would encourage everyone to look at that and watch that on the best ways that our community and our companies can step up and help the Red Cross. Adam will be in touch, I'm sure. We'll bring you back on. Finally, Mark Newman, I'm going to bring it to you, as we always do, to end these things off, to give us an update on where we're at with Slope Serves, where we're at with testing, where we're at with medical supplies, and everything else. And again, Mark, I want to acknowledge you in the same way I did Ryan Smith for your donation to Slope Serves during this critical time. I appreciate it, my friend.
Thank you. I really admired the Mr. Rogers reference of look for the helpers. We're all sitting at home. We have plenty to do and can do. And to bring it all home on a Friday afternoon at 5 o'clock, why not end this with a PowerPoint presentation? So this is update 3 for everyone, so that we have a sense of normalcy. It's been a fantastic week, and we'll go through it. I guess here's the news. So first off, we are absolutely rolling. You're amazing. Sitting at home, and let's get productive. If there's team members on your team, we've had 70 volunteers sign up to help contribute service. And that was without even an email blast, right? So if you have people on your team that need to feel productive, figuring out what are their skills, what are safe ways for them to be able to participate, whether it's picking things up, whether it's doing things online, whether it's, we've been asked for how do we do a community support program for analytics, for legal help for this, like the volunteer community and Ben at your team is incredible. We know it's getting worse here, economically, health-wise, and access, and that's why we're mobilizing the private sector. And you've heard it a bunch of times today. I'm going to go into the details. There are critical needs around supplies, protective gear, masks, goggles, gloves, swabs, reagent. We can get this solved. How can you make it at home? Well, get work done by keeping people employed. We've had a painting crew come in to our house. So here is the command zone for Slope Serves as we speak, and in the nice new painted room that we've had. As we said, we've mobilized. Order of operations. We launched Slope Serves. We're sending out a pulse survey as well today around what's going on in Utah. Share it with your friends, share it with your people, share it, just get it out there, because we want to see how people are feeling and what's going on. Kind of a more community-focused version of an engagement in pulse survey, as Ryan mentioned. Monday, Tuesday, incredibly exciting. We had a press conference today at the Capitol launching COVID-19 digital assessment. You'll see a lot of kind of fairly basic assessments or surveys that are like, oh, are you feeling symptoms? Do you have this? To scale up testing, we want to bring a major digital solution to bear that could actually even route care and route access to care as well. That'll be launching next week. There's a press conference today. Next week as well, we're launching the supplies drive. Call this the statewide Eagle project or service project. We're really good at those here. We're going to pick a day that says, all right, let's go get it all. Let's collect it up and let's get it to the health department. As well, I want to give a shout out to Meds in Motion. Dan Richards over there. He's been leading the charge with members of the health department, with members of the state, President Adams and the state Senate. They are launching a large order on standing order for hydroxychloroquine and chloroquine, which many of you have seen in the news around potential treatments for this for people exhibiting symptoms. And they've also aggregated together the materials for 20,000 plus patient packs that we actually want to subsidize and give out to the community for people that are in need. This is something that I think exemplifies Slope Serves, the reason why we're here and what we want to do. This has been a Herculean effort that we're seeing incredibly cool organizations step up. There's capsulator companies in Utah that can make 1 million pills an hour. There's this, there's that, and everyone's raising their hand saying, I can help. We can test purity of ingredients. So Nelson Labs raised their hand saying, I can help. New Skin's doing, it's like everyone's raising their hands to help. This is the true mobilization of a private sector like I've never seen, and Dan deserves a big high five for it. And continually, you heard from the state the update. Like I said, a lot of times the private sector, I said earlier to a few members of the Congression, I said, sometimes in the private sector, we see a bone and we just start chewing on it, right? And we just keep going and we just keep gnawing on it. What are the goals? What are the ramp? What are the numbers? What are the goals? What are the ramp? What are the numbers? And in some ways, for the government's board of directors right now, asking for the results to continue to expand. I don't think we should stop until Utah's doing 100,000 tests. And we're going to just figure out all the blockers for that: tests, locations, materials, products, supplies, and be unrelenting around how we can. On the supplies front, this is the most critical need in Utah right now that everyone can help in this community. Private, PPE, protective equipment. These are Tyvek suits. You've seen them. Goggles, masks, gloves, bleach wipes. We've been starting to get asked for diapers and things like that. We're going to figure out kind of the exact approach on here. This isn't about just things that go through Slope Serves either. Let's share the stories. Goldman Sachs uncovered masks from their disaster prep. They did this in New York. They're doing the same thing in Utah. RSL donating food from their stadium. Lieutenant Governor Cox talking about 700 reagent extraction kits that someone just had. We've had professors come out of the woodwork on chemistry departments saying, I've got those, or we can make those. This is where the magic's happening and where we're going to be the most proud. So go to the site, volunteer, say what you have. We can set up people picking it up. It's going to be amazing. Our timeline. So sourcing currently underway, crowdsourcing supplies, fundraising, volunteer identification, assessment available today, next week. Before we hit that. I want to walk through now for a minute how we get more testing and what we need to ramp to testing 100,000 physical tests in, call it 2 weeks from now. Utah's in a couple thousand range, ramping up quickly. To do the tests, because we've had a lot of questions around here, you need trained people to take samples, sites to collect, tests to conduct, and labs to evaluate. Okay, so and inside of that, you need these elements. Trained in taking nasal respiratory sampling. We've seen the Med Central idea come up on the home test sampling. We need to get that evaluated as a viable alternative. But personal protective equipment. You can only put people at test sites if they're protected in doing their job. Right, and so that's why this is so critical. It's a critical risk for us to be able to do this. And this is also going to expand to: do you have tents that we can be using? The big kind of canvas tents that people can drive up to. Sites to collect. For the current volume, IHC, Stewart, and U of U are doing a good job, like kind of having sites. But for instance, in Utah County, there's one site, University Parkway, Orem Clinic from United. University Health Systems. Potentially IHC might be doing a few more. To get to 5,000 to 10,000 a day in terms of tests in Utah, you need a couple of things. High volume locations. So we've had 1-800 contacts, Adobe expressed interest in there, blanking on all the names, volunteer parking lots that are empty and no people are there for them to set up testing sites. We need high volume. We had the massage company, on-site massage company, volunteer their event management software, because essentially we could set up 10 units of tests and people could claim times to go get tested, especially if they've done the digital assessment beforehand. So instead of 10, 20 an hour, based on people just driving up, what if we could do 200 to 500 an hour or 200 an hour per site, excuse me, to kind of keep driving it. Volume of tests. Digital assessment goes live next week. Co-diagnostics. They've been a fantastic partner, as Lieutenant Governor said. They're moving forward, getting it going. We're seeing other opportunities like MedCentral and home testing kits board. We're just going to move it. But the labs and what they need is the reagent and then CLIA certification. If you have a CLIA certified lab, reach out to mark@nomihealth.com. This might be at universities. This might be in the private sector. We've had it from all sorts of places. We need more places to test. Currently, IHC can do a couple hundred per day. State Department can do 100 to 200 a day. ARUP is trying to ramp up the volume there. We need more space. Okay, any questions?
Mark, real quick, for me, this co-diagnostics thing and the confusion that's still kind of out there. Can you help? I know that you've been in touch with Seth over there as well. Can you help just give a sense for what's going on there? And there was some confusion, like, hey, they're going to be able to produce 50,000 a day, and it's definitely going to, and we'll be able to take 50,000 a day. And can you just give us walk through, because I know there's been misunderstandings kind of on all sides there.
Appreciate that. So Co-Diagnostics has the tests, massive volume of tests. We used to drive past their inventory of tests. So the test actually isn't the critical risk factor in all of this. The labor and people and the sites is one hand, right, with the PPE so that they can actually capture the tests. But the other part, and this we totally didn't anticipate, which is why we have this wall we need to break down, is the reagent inside of CLIA labs. ARUP, for instance, is the major laboratory provider here in Utah. They are a terrific company. They are shifting and had to shift their entire testing capacity towards this initiative, which is not easy to do in a large organization, and they've been ramping up. So they've been at kind of 100, 200 range for a while from what we've heard, and ramping up to try to be 1,000 a day. Dependencies on that. Trained labor, which we think we've now close to mitigating, and this reagent. And the reagent, from when the last meeting, Co-Diagnostics and any testing company, not just Co-Diagnostics, but any testing company does not provide the extractive reagent that a lab would have as part of their general chemical supplies that they use across all their testing for various things. It's called PCR testing. And there was a mix-up of like, well, do the test companies provide that, or does this, or does that? It's the labs that have the ink, I believe. It was Lieutenant Governor Cox used it as the analogy to pull that out. And it's the test companies that provide the test for it all. So testing companies rolling, same thing with like a MedCentral, same thing with any other private sector test that could kind of come into play here that we can get validated and approved. We just have to marry up both the capacity of the existing lab infrastructure, IHC, State Lab, and ARUP, with adding on additional labs that have both the machines and the chemicals necessary to be able to run the tests.
Mark, what about this MedCentral home testing kits? Have you done any validating there? I know like Sid Tetro from Women Tech Council and Sarah Danzy Jones and Brock Blake from Lendio. There's a lot of folks who are, super diligent around that as a solution for home testing. And, as you saw in our conversation with Lieutenant Governor Cox, we're putting them in touch with the government and with the task force to get that validated through labs. But give us your sense of the MedCentral home testing kits. What do you think?
Yeah, I don't know enough about them to be an expert. What the notion of it is, blood pinprick test to take at your home, right? As almost like a cassette type setup, almost like for diabetes patients, a lot of times testing their insulin. That would work for a lot of environments. It also could work for commercial environments where if they ever suspect a case in, say, an employee base or something like that, they can have a quick test to be able to do it. It's a medical device that needs to be approved, not just the test component. So we're trying to find out what that is. There's this whole ranking of level 1 through level 4 medical devices. And you have to kind of go through this path to be able to understand that. Your help in terms of at least getting them an audience and a discussion for understanding the needs, the ways to do it, getting it in, et cetera, would be awesome. And if it's a viable option that we can get validated, either in academic labs, through the FDA, et cetera, as fast as we can. I think that would be a terrific add-on for people to do. We also have to make sure that the price point is right, to be completely clear. Every solution that we're bringing to the table here has to be accessible to every Utahn. And thanks, some people in other places on profiteering off this process. We saw, for instance, hydroxychloroquine go up from 14 cents a pill to $25 a pill in the last 48 hours after a kind of run on pharmacies. That's the fastest way to break this down. So we are trying to ramp up with great tools that do great things at the right price point for every Utah. And I think MedCentral could be an awesome solution if we can kind of follow the path to get it approved, get it imported, get it available.
Mark, I have an interesting question from you, from Lex Watterson, who's watching here live. He's wondering if there's a possibility some people were exposed a month ago and have since recovered and thought it was a different illness, but was actually COVID-19. Can people who have recovered be tested and identified? And is there value in that?
I have no idea. So what I would actually offer up is on say Wednesday next week, rather than all of us business and political hacks, what we should actually have is just clinical people, right? Kind of the ask me anything for a number of doctors.
We will do that. That's a good idea. We will do that.
It would be an awesome session. I have no idea, Lex. And if I was telling you an answer, you could just say, I'm going to tune off now.
And Sarah Dansey Jones, if you're on, we're getting some confusion as we're streaming this here around the home test kits, and whether they actually test for the virus or if they test for antibodies. Can you come on and help with that?
Actually, Chowie Hoy is on. She is.
Chowie Hoy. Yeah, Chowie.
I want to defer to her.
Yeah, Chowie Hoy. I didn't know you were on. Please, can you talk about these home test kits? Is she on or unmuted? Well, the nice thing is we've actually done a live with Chowie as well. We did that yesterday. Everybody can go watch that. And we'll put out an answer to that question around whether it actually tests for the virus or just the antibodies. I think that's an interesting question there. All right, Mark, how do people get involved? Give a final call to action here.
Let's wrap up. So Slope serves $1.5 million in. Every dollar counts. Go to slopeserves.com. If you're a large organization, donations at siliconslopes.com. Let me show you an example of how we're putting even $2 million to work right now. Let's get this done and get people back to work. So example, digital assessment. SafeLane Health's been developing it. There's also other pieces to it, but covering off their hosting costs just to be good stewards and keep them in business. Awesome. In-person testing, whether it's the co-diagnostics test, self-assessment, finger prick devices, et cetera, making sure that there are no barriers to people of Utah being tested. We want to put Slope Serves dollars to work there. And then medication packs for 20,000 plus people on the hydroxychloroquine and chloroquine type setups. Meds and Motions led the way, and Doppel as well, and the various kind of groups led the way, putting it together to say, listen, like pharmacies, let's be mindful around who we're prescribing to and who we're dispensing to. Let's make sure that we're keeping supply for Utahns, for people that need it, and let's do it at a price that covers costs, but it is not what's going on. To give you a context from the Meds and Motion standpoint, at this point in time, those prescriptions are now selling for $200 to $500 in the private sector because of massive price increase. And we've locked up supply and we're getting it produced for $40 a person here in Utah. Okay, so this is the type of thing where we're putting it together. We want more companies involved. I'd also like to highlight WCF Insurance, Workers' Compensation Fund of Utah. Matt Liner over there, he has been incredible. And also stepped up with another $100,000 donation that's helped lead the way on getting standing orders, digital assessments, and this entire thing in play. We need more friends, more partners, more companies to come in and be part of this, because this will be pretty magical and the blueprint for the entire nation.
Thanks, so, Mark.
That's how it is. Thank you to everybody. And this is the ask. Just come in, come on board, come help, come serve. We can do this.
Mark, thanks so much. Appreciate it. I want to thank everyone for watching today. I want to thank you for your participation in this and everything you're doing for our community. Please go to slopeserves.com to learn more on how the Silicon Slopes community is coming together on this issue and how you can help. I also want to remind everyone we do these every Monday, Wednesday, and Friday at 4 p.m. Our next one's at Monday. You can get the agenda. You can sign up for our Slack channel. You can get the agenda for these calls all by just going to slopeserves.com. Everybody have a safe and happy weekend. We are going to get through this. Thank you very much.